and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Indy Prabhu. He's a medical student and he wrote the Kevin MD article, Issues Faced by LGBTQ Individuals in the Operative Setting. Indy, welcome to the show.
Hey, Dr. Poe, thanks for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yeah, sure. So I was born in Bangalore, India, and I was there until I was about 2.5 years old. And then my parents moved out here. And by here, I mean the Bay Area in California. And that's basically where I spent the first 22, 23 years of my life. And I did my undergrad out there at UC Berkeley. And that's kind of where I decided I wanted to do medical school. And I found myself where I am right now at Toro, Nevada, out in Las Vegas. And my current interest is going into anesthesia next year.
So I understand you're in your fourth year and you're interviewing for residency. So how's that experience been in the midst of a pandemic?
So it's been interesting. Everything's been done via Zoom, and the sad part about that is you don't get to visit the program, you don't get to get a feel for the campus, for how people are interacting. But at the same time, it's made for some interesting experiences where people have done virtual interview tours, virtual meet and greet sessions where they give you an Uber Eats gift card and you do the resident dinner virtually with them paying for it. So it's made for some interesting experiences as well.
Wonderful. And any tips that you could share with your fellow fourth year medical students who also may be interviewing virtually during residency season?
Definitely biggest thing is have a dedicated laptop that you know is going to continue working and have a stable Wi-Fi connection, because I can't tell you the number of times that things have gone wrong and at the worst times. So just make sure that you can optimize everything on your end to make as seamless of an experience as possible.
Great. So let's transition now into your Kevin MD article, Issues Faced by LGBTQ Individuals in the Operative Setting. Now, for those who haven't read your article, can you just summarize the story, walk my audience through it, and share the story of why you decided to write it?
Yeah, so actually this happened on one of my anesthesia electives. It was just supposed to be a simple cholecystectomy case, and as a medical student, they let me do the preoperative clearance. And when I was talking to, and I'll use quotes here, quote unquote, him, a young 22-year-old male, he suddenly had an angry outburst when I asked him how he was doing. And then he quickly apologized and burst into some tears. And, he told me, sorry, he didn't feel comfortable in the setting. And when I pried a little bit more, just as a good historian and medical student should do, he told me he actually felt as a woman trapped in a man's body. And that was eye-opening to me that, first of all, that I was having this experience in real life because I'd never had that before. And on top of that, that he was apologizing to me, even though he was probably going through so many struggles, albeit I wasn't trying to come from any place of malice or anything like that. But he told me he felt quite uncomfortable in the operative setting because he'd had experiences in the past where people were discussing his case with an earshot of other families and other individuals that made him uncomfortable. And on top of that, he could tell when sometimes providers were doing their best not to walk on eggshells and doing their best to, not breach this subject. And he felt he really couldn't be himself on top of already the struggle that he was going through internally. And he told me for, easiness sake, I could just call him he. But, we established a bit of rapport as we got more into our conversations. And I think that, this was a very telling experience for me because I didn't know that this sort of struggle existed in the anesthesia and surgery realm. To be honest, I thought it was more of maybe, a primary care or maybe not even too much in healthcare. And so it was a very eye-opening experience for me. And I just did my best to try and validate his experience, let him know that, it's going to be okay. I'm here to listen, and let him know that other providers will hopefully be listening in the future as well.
As you were listening to this story, did he describe some of the scenarios that he had encountered that made him feel so apprehensive in this particular setting?
I think one of the biggest ones that stuck out to me was that when he had mentioned in the past, when he was a little bit more comfortable sharing before any of the bad experiences that happened to him, I think he mentioned that he had told another student or resident that he felt this way, and that resident maybe they panicked a little bit, or student they panicked a little bit, and they offered him a pregnancy test. And that completely, shattered some of his confidence because he didn't know whether they didn't know kind of what a struggle was, whether they were, maybe he felt they were poking fun at him. Either way, it was something that really negatively impacted his outlook on medicine. And he was telling me that, if the pain wasn't this bad for his gallstones, he was even considering not coming in to have the surgery done. And that was shocking to me because that is something that I don't know how many other people are doing the same thing. And that could be the difference between life or death. And so that was really a touching moment where I realized that there are a lot of people doing this.
So you had mentioned that you comforted him and validated what he was saying. What are some of the ways that you did that?
I think the biggest thing for me as a student in any of these kinds of scenarios actually is just letting the patient talk a little bit. And, not a lot of times, there's some papers in front of you, there's charts, and, you'll be looking down and looking at the chart and nodding. I think in this case, I just maintained eye contact. I smiled when it was appropriate. And, I moved close to him. I sat down, I didn't stand. There were some chairs there that made it nice to do that. And just sometimes, put a hand on his shoulder here and there and just listen to him and then ask him, pertinent follow-up questions or, make pertinent remarks to show him that I am actually listening and I'm not, thinking about the next patient or I'm not thinking about what I'm going to say to the attending. And it just became a conversation at some point. And I think in that way, it made him more comfortable sharing the story and it made him realize that maybe this guy's being genuine. So I think that those are some big ways that he was validated.
And in general, what are some of the issues that LGBTQ individuals face within our medical institutions?
Yeah, so I think some of the things that he experienced are probably the biggest ones. I think coming from anesthesia, from an anesthesia perspective, I can definitely say that sometimes with the preoperative discussions and talking to the surgeons and things like that, it's definitely done in pre-op area where there's a lot of people. The only
Hmm.
things separating the rooms are curtains, and you don't really know how comfortable certain people are sharing certain things. It might not even be in terms of LGBTQ, but some people may not want other people to know they have diabetes or a certain condition or things like that, or that they take blood thinners. And so I can say this happens a lot. And so I think that's one big thing that he mentioned as well as T and LGBTQ, transgender people. Sometimes it is actually pertinent to offer a pregnancy test because sometimes it's not just a man feeling that he is a woman trapped in a man's body, but it could be someone that had had an operation and they may have formerly been a woman. And, it might have been, this might be in the period where they're still on hormone therapy and it might still be viable that they could have a pregnancy. And so those are more instances where it could actually completely change the way care is delivered, not just how it's felt that it's delivered. And I think that's another big one that I saw in some of my, when I was looking things up and trying to figure more ways that we could change.
And during your medical training, did you have any education to issues related to the LGBTQ population?
Yeah, so actually in the article that I submitted to you, I was discussing how there's not really enough training. Fortunately, where I am, students voiced their opinions on this, and some of the faculty and administrators had some guest lecturers come at lunch, specifically coming to talk about these sorts of issues, not necessarily in the operative setting, but just generally in the healthcare field. And so I would say that, we did get a decent bit, and maybe that made it a little bit easier for me to handle this. But at the same time, I feel that, some of the doctors that are already in the field may not have had that training. So it's not really fair to say that, hey, it's their fault or anything like that, but more that maybe they didn't have the training and maybe they want to learn. And so I think that one of the things that we can do is kind of maybe implement some of these training sessions in within residency and maybe even require doctors to go to some. And I think that'd be a great idea.
We're talking to Indy Prabhu. He's a medical student. He wrote the Kevin MD article, Issues Faced by LGBTQ Individuals in the Operative Setting. Indy, after hearing the story and reflecting and going through this experience, what are some recommendations you have to other medical students and, for that matter, other healthcare workers?
One of the biggest things that I learned from this is that the humanistic aspect of medicine definitely matters. We stress it in school. It's always part of the OSCE grade. You gotta have the content, and you got to be a humanistic person. That's part of the grade. But after that, the stresses of, hey, you got to deliver this many patients care. You have to do this many surgeries. I think the pressure of volume output definitely shows up. I think there is some merit to that. At the end of the day, you do need to provide care to many patients, but at the same time, I think it's worth the investment to take 1 to 2 minutes and just listen to people and just listen to what their story is, listen to what they have to say. There have been studies that have shown that someone with a positive attitude, positive mindset that is generally happy does much better post surgically than someone with depression, let's say. And so, if you were to take the time to do 1 to 2 minutes of this, it would not only help just be a good person and establish some rapport, but it might actually help your post surgical outcomes as well. So, everyone's happy at the end of the day. And so I learned about the humanistic aspect. And I think that's the biggest thing is just we need a little bit more training in this regard. There's a lot of people, there have been studies out there that have shown a majority of physicians just don't know how to approach the situation for not necessarily any fault of their own. And I think just being willing to understand different perspectives that people have and being able to understand that people go through different things. And just because person A experiences it one way doesn't mean person B is going to experience it the same way, I think would do wonders for everyone involved and really improve the way that we can deliver care and shape the field for the better.
And those of us who want to read more about LGBTQ healthcare related issues, what kind of resources can you recommend?
I found PubMed to be fantastic, especially for my personal article, surgery and anesthesia and LGBTQ issues in that realm. There have actually been a surprisingly large number of studies looking at what those issues might be, what percentage of physicians are comfortable with it, what we can do. A lot of those studies in the conclusions kind of provided what their thoughts were and, why certain things might work, what certain things might not, what the feasibility of a lot of that is. And I think PubMed's a fantastic resource. I would maybe stay a little bit more away from not as reputable sources because we don't know where they're getting their information from. But I was surprised to find a lot of evidence-based research in this area.
And my final question, what's your take home message that you want to leave with the Kevin MD audience?
I would definitely say the take home message is just listen to your patients. They have so much to tell you. I've always been told that for histories, your patient knows, listen to them. I think we can go beyond that and listen to their experiences outside of what they're just coming in for. This individual was coming in young 22-year-old. I think that was the most touching part is he was younger than me. And I'm always told, oh, you're so young by all the patients. But, he was coming in for a cholecystectomy. I could have asked him a bunch of questions about his pain, fever, chills, things like that. But I just had to listen to him for about 2 to 3 minutes about what he was going through. And I think it made a huge difference in our overall what he took away from our encounter as well.
Indy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much for having me.